Well, as in most things in the schools, the children shall lead us. And a child came to me and said, if we're really not supposed to be smoking, why are people smoking behind the school? That was a hard question to answer. You know, in probably all schools, but particularly in a small school like ours, we had a really hard time finding a place that a staff member who was a smoker where they could smoke. That would be a place where the children wouldn't see them, because we use every crevice and cranny for education. And we thought we had found this little alcove behind the school, but it turns out that some of the classes were walking past there as they went to recess. So they were seeing some of the adults in the building smoking. And so that really got me to thinking, like, this is not good. You know, we're trying to teach tobacco prevention and teach kids healthy habits, and we certainly want our schools to be a safe and healthy place, and yet we're not walking our talk.
We teach our children in guidance classes. I teach children about being healthy and making healthy choices. And we talk a lot about tobacco and how it hurts your body and how it's not good for your lungs, it's not good for a variety of reasons. And seeing our adults on campus not smoking, I think, sends a good message to our students that we're all in this together and we're all working to be healthier.
We tried to put together a district committee with representatives from a wide range of areas. The main thing that we did as a committee was put together a survey. We surveyed middle school students and high school students. We surveyed parents of elementary, middle, and high school students. It was available for community members. We surveyed the certified staff and the classified staff. And we had, I think, close to 2,800 people responding to the survey. Of course, the parents of the elementary students, we had a little bit higher response there than we did from the middle and the high school. It was a completely voluntary survey, so we were pleased to get the response that we did.
Well, we did have a survey that played a role in soliciting feedback. We had Dr. Mary Evans come and share her perspective along with some students, their perspective as well. And the board listened to those comments and then had some discussion, some questions back and forth. And from there we drafted a policy that took 2 readings as required by law before it becomes a policy in school districts. And it was really a seamless process. I think everybody knew that it was the right thing to do. We wanted to set the right example for our kids, our community, and of course anytime you can be out in front and be a leader, that is always enticing as well. And of course in this case we were able to do that for our community.
One of the things that I do every year, starting from kindergarten through 6th grade, is we have a whole week where we talk about being tobacco-free, alcohol-free, drug-free. We call it our Red Ribbon Week, and we talk a lot about tobacco because that seems to be the most prevalent that our students understand. And we talk about the harmful effects of tobacco. We give them as much information as we can. I have the Barren River Health Department come in and teach those classes because they have so many wonderful resources and visuals that they show.
Provide a healthy environment not only for where our kids are educated but also where they participate in activities such as athletics. Signage is an important aspect of communicating, so we wanted to ensure that we had signs posted strategically throughout our campuses, but also in such a way that we didn't offend, we just informed. And we feel like we've been able to strike that balance. And from my perspective, now that we've been tobacco-free for almost a year, I don't see a lot of violations, and in case we do see someone violating, we have a procedure in place to ask them to please stop, make sure they're aware of what our policy is, and our community's been very responsive and cooperative in all those instances.
as I've worked in this and thought about this more, it really kind of made me think, we really have a double standard. We're saying one thing in health class, but yet they look all around and they see things that are supporting smoking instead of discouraging it. And so that was one of the things that pushed me even more to really work for having a policy.
We think overall it's been a very positive for our school district, our community, and I would certainly encourage others to examine it closely. We all have the same goal in the sense that we want everyone to live a happy and healthy lifestyle, and we're confident that this speaks to that goal.
Excellent. Everything? Yeah.